This is the patient as he returns 6 days later. He's been wearing this about half time during the past 6 days because his time has been preoccupied with a school play in which he has been participating in it. But now he's promises me he is going to be wearing it 24/7 for the following 2 weeks. What I've done is in the past 3 or 4 minutes rebalanced the occlusion so he's hitting evenly on both sides. And his jaw is repositioned so his lower jaw is advanced and his incisors meet edge to edge. Wait. Zero in on this. This is his occlusion right now. Open wide. This is the appliance in his mouth, and it's highly indexed. Bite. Now see, and he goes right into the indexing, and this moves the mandible forward, taking the pressure off his temporomandibular joints and reducing the recurrent dislocations. So just look into the camera and let them see your face. Do you want to mention any benefits or non-benefits you've received over the past 6 days?
Well, actually, I got a lot of benefits. Right away, I actually, I stopped doing ticks a lot, and lately I haven't done them at all. But I did take my brace off one time, and I actually had a tick explosion where I was going nuts. I think that happened because I took the brace off. So that was the downfall part. But I think this brace really works.
You had 58 ticks originally. Didn't we just establish that at your initial appointment?
Yeah.
Okay. Okay. Let us see you in 3 weeks, and I really want you to wear it faithfully. Okay.
Okay.
Good. This is my buddy Jesse. We gave him this lower appliance. Let's see, a month ago, and he wore it for a couple of weeks, and then he lost it, and he came back, and we took an impression a few days ago, and so he's been without the appliance for how long would you say now? A week or 10 days?
Yeah.
Something like that. Okay, and then we're going to deliver him a second appliance in a few minutes, and so we just want him to tell the audience what happened while he had the appliance and what happened after he lost it and how he feels now. So look at the camera and tell the audience how you were doing before and after you lost it.
Well, when I had the appliance, I was really calm and I didn't do ticks nearly as much. In fact, I kind of forgot I had Tourette's more than I usually do. With school and stuff, I just was barely ever doing it. I took the appliance off for about 4 days, and I actually had a tick explosion, and where I was going nuts with Tourette's, and then I put it back in like the next day, and I was all calm again. So it was like, and nothing happened. I feel really good with it, and it's just like like I said, I don't notice I have Tourette's when I have it, not as much. When I lost it, I was really bummed because I lost it, because it was like really my only way to get out of it, and I kind of felt like I was more hyper, like afterwards, and that I sort of kept getting off track. I couldn't stay focused anymore in school, and actually I did really bad on my last 2 tests, and I'm not turning in homework, and because I can't stay focused. But when I had my brace, I could always stay focused.
I am letting the camera run so that the viewer can observe these ticks that have returned, particularly his foot ticks and his head and neck ticks, as well as his vocal ticks. Had he worn the appliance for 2 or 3 months steadily, these ticks would have not returned. For the professional viewer, please keep in mind that I have only seen one patient that did not have an underlying internal derangement of the temporomandibular joint as a cause of these tics. Please keep in mind that there are 3 types of internal derangements, not 2, that occur in the temporomandibular joints. In addition to the click and the locked joints, there are ones in which the disc is in proper relationship to the condyle, but both the disc and the condyle complex are in malrelationship to the posterior slope of the eminence. That was the one exception that I have encountered over the years in treating these patients. The reason you are seeing more boys than girls with this affliction is that studies show that Tourette's is 5 to 6 times more common in young males than it is in young females. And it usually begins at 7 to 8 years of age and increases as these children go into the teenage years. Some of them outgrow it, but a lot of them do not outgrow it. We have treated these patients in their 30s and 40s, but the bulk of them are in their teenage years, from 14 to maybe 22 or 24 years of age.
Yeah, I know.
Okay, your thing is hardening up. You're modifying.
It's starting to get kind of hot in here.
Huh?
Is it hot in here, or?
Not particularly, but he's probably is. Yeah, I'll be, as soon as it gets hard, I'll bring it right in.
Alright. I'm starting to get really tired. I'm starting to sweat. Wow, dude, why am I doing this?